Hi, in this video I'm going to make an overview about the bodyweight support systems and exoskeletons for the lower limb and gait rehabilitation. So let's see what are the training options for the lower limb using rehabilitation technologies. The options are overground training with bodyweight support. Second one is overground training with robots or exoskeletons. And we can mix that with treadmill, like treadmill training with bodyweight support or exoskeleton. Let's start with the first option, overground training with bodyweight support. In this video, I'm going to talk about the Andago system by the company Lokomat, the Litegait system, Zero-G system, and Litegait system. The first overground training using the bodyweight support training is the Andago system. It was developed by the company Lokomat in Zurich, Switzerland. It's actually a frame with bodyweight support that enables the patient to walk freely around the room. The patient can even turn, and the sensors in the system can detect the movement, and it can improve the different walking parameters and the biomechanics of the walking. The disadvantage, however, is that this Andago system is very expensive, and very few countries and clinics has it. Next system is Litegait. Litegait is an unweighting system because it has a frame with bodyweight support or suspension, and it enables a patient to walk over the ground or on the treadmill, but it doesn't have sensors as like Andago. It's less expensive, but it enables the patient with the safety bars. The patient can freely walk and there is no risk of falling, which is a big advantage of this system. Next equipment is Litegait system. Unlike Andago or the Litegait system, the Zero-G doesn't have a frame. There's only a cable connected to the roof. So the cable connects to the harness. The patient wears the harness and can walk in a room. But the disadvantage is that this Zero-G system requires a big, spacious area for the patient in order to walk. And the modes are assist mode and resistance mode. By the resistance mode, the system can give resistance to the walking, so it makes it challenging. It gives a dynamic balance support when the patient is using it around the clinic. The Litegait system has 2-point suspension, so the patient is more supported by this system. There is less rotation in the spine and the hip allowed. So for more disabled patient, the Litegait system is used. It's for walking over ground or on the treadmill, as you can see in the image, and it's also less expensive than the Andago system. So in a nutshell, let's see the advantages of the bodyweight support. They increase the symmetry of the gait. They decrease the compensation. For example, if the patient is compensating by hip circumduction or like decreased time of single link support, these systems decrease the compensation. For instance, they improve the walking speed, they are safe, and of course they psychologically help the patient, so their fear of falling decreases, which is a big advantage for the elderly, for instance. Furthermore, in some researchers, they found that the speed and the endurance increases, the stride length increases, and the walking distances significantly improve by using the bodyweight support system. On the other hand, the disadvantages are, for example, many staff are needed to support the patient, to, for example, help with the foot placement on the floor, to help the patient to put it on and to take it off. Many staff are required. It's only possible to use the system is in facilitation and in centers. Because they're expensive, they're not available in all the countries. And some studies found that they do not change the walking biomechanics significantly. However, they are beneficial for some factors such as the endurance and for stride length and etc. So far we discussed the bodyweight support. Now let's talk about the exoskeletons or the robots. So the option are overground training or on the treadmill. The first one is Lokomat. So the Lokomat is an exoskeleton. As it sounds, it's an external skeleton. So it supports the hip and the knee in sagittal plane. So it facilitates movements like flexion and extension. And the modes are full assist and partial assist. So it can be used over ground or on the treadmill. Next system is the Geo system. So as you saw, the Lokomat supports the hip and the knee, but the Geo system is an end effector, meaning that there is a foot plate and patient is directly in contact with the foot plate. With the harness, the weight of the patient is supported, and there is also a hand bar, and the patient uses the foot plate to walk. The modes are active and assisted active. However, the disadvantage, there is no heel strike. So in a normal walking, as you walk, you have heel strike or heel contact first. So the contact gives you a proprioceptive input, and that activates subconsciously some of the muscles. But when you're using the Geo system, there is no heel contact, so we lack that proprioceptive input. Next device is a sophisticated one, the EKSO GT. There is a weight limit for it, maximum 120 kilogram and 2 meters height. It's a self-powered robot, meaning that the motor is in a form of a backpack, so the patient has to wear it. It has a low range of motion, so it only assists the movements in sagittal plane, such as flexion and extension. So basically, it's a very huge exoskeleton. It supports all of the body except the ankle. And the modes of activity are the pro step mode, which the patient has to do some form of weight shifting. As the patient does some sort of weight shifting, the robot detects and helps to push the body, to push the limb forward. And the other option is first step mode, is that the patient doesn't need to do the weight shifting, and the therapist, as the therapist press the walk button, the patient and the limb will move forward. It's designed for very severely affected patients, and it's not possible for very severely spastic patients. It's not possible to use. If a therapist wants to practice this EKSO GT with the patient, they need to hold a certificate, the EKSO GT certificate, to be able to practice in the hospital. And obviously, this device is very expensive, and in very few clinics it's available. So overall, the robots cannot take over the job of a therapist, but it can be a good complement to the conventional therapy. It has numerous advantages. For example, it has less physical demand on the therapist. The therapy duration can be increased by use of robots. They are motivating actually, and we can expect a better movement quality when using the robots. There is more control on the movement. Some parameters such as speed, endurance, distance will improve. They saw that in case of Parkinson disease, the freezing of gait decreased with the use of robots. And it improves also the balance in patients. The bowel function and bladder function also improved because they're in standing position. That function also improved in patients. Alright, that was it. Thank you very much for watching this video.
Changing who I am, I'm making a new plan, rearranging my life